my colleague, Dr. Amitav Banerjee, who is Professor Emeritus from D.Y. Patil, Pune, a very eminent place, to give his views about the integrated medicine and where Dr. Amitav will like to take over.
Yeah, thank you, Professor Agarwal. It's a pleasure to come on this platform of Double Helical. And as you rightly said, we had a very old culture of healing and curing and caring also. And we had perfected the art of medicine. Medicine is the oldest art and it is the newest science. And after, rightly, as you said, after the 17th, 18th century, the scientific or modern medicine gave it a added year of a science, which is the newest science, but the oldest art. So in our eagerness, we are rapidly making technological developments and specialization and sub-specialization, which is a good thing. But we are actually solving the patient's problem in piecemeal, not as a holistic. So this ancient systems of medicine like Ayurveda and other systems, they have this holistic approach to the patient's diet, lifestyle, environment, which of course the modern medicine practitioners also lay stress right from the times of Hippocrates. And even today, those who are good modern medical practitioners, they also stress first on lifestyle, diet, physical activity, and then pharmacological intervention. And particularly chronic diseases like diabetes, obesity related, coronary heart disease, even some cancers can be can be coped, can be treated with lifestyle and then intervention with drugs. And if you have a good lifestyle, unfortunately, the modern medicine is stressing too much on technological advances and the same other limitation of ancient system like Ayurveda are that they are not adopting good research. And if these two systems come together and as a team, if they practice, there are a lot of potential for Ayurvedic drugs also to find place in modern medicine. And we have an example from China in 2015, the scientist who found out the benefit of Artemisia in malaria got the Nobel Prize. So in Ayurveda also we have a large treasure of herbs and other products which have not been researched, and now I think there are a lot of institutions in India which is doing the research. So integration should be at the research level, and integration can also be at the practice level in a day-to-day practice, like the history taking, the talking to the patient, counseling the patient on lifestyle. 90% of this lifestyle and physical activity are common interface between modern medicine and Ayurveda. There should not be any compartmentalization. So the patient can be first counseled, pre-treatment counseling, post-treatment counseling can be by the holistic systems of practitioners, and if they work together, they will learn from each other. I think there's a lot of scope. So that's all I have to say. Thank you. So muted, Asara.
Thank you, Dr. Banerjee. And I think you have very nicely explained that why we should go into integrated medicine. And if I try to say that if the question asks who will go for integrated medicine, don't you think India is the first country, because India is very rich as regards our ancient science is concerned.
Definitely, sir. We have got.
We have a history of more than 1,000, 2,000 years back. And of course, you rightly said that we have to create more and more evidences, but don't forget the perception is very strong. And sometimes perception is also very important when we talk about treating a patient, because people are having their own